Hello, everybody. I want to welcome us into this wonderful broadcast. We are here again on this hour of Recovery TV, and we've been dealing on some series on addiction and mental health. And today we'll be going further in this direction, and I believe other direction that will help to give more light into other area of what I call personality disorder, which is a form of mental disorder that can be problematic in terms of diagnosis and treatment. And these are key challenges in psychiatry, and for number of reasons it involves an ongoing and long-term pattern of instability of mode, and difficult to predict behavior. One of it to be dealing with today will be on addiction and bipolar disorder. And joining me today on this program will be Sister Sharon. She will join me on this program as we'll be discussing about this issue. So I'll bring her on. Sister Sharon, you are welcome. All the way from DC. We are very glad to have her here. She's been a very gracious person that have been with me here on this program. We've been covering all manner of area of program, and I know that today you are going to enjoy our presentation on this area of addiction and bipolar disorder. Like I said, these are behaviors that are difficult. These are people with behavior that are difficult to predict. You don't know what is going to come on next. And sometimes this may lead to sense of confusion and may even trigger negative feelings in workers trying to help this kind of people. But in some area, when people have understanding of this type of illness, it helps people to know how to empathize with these people, which may help to bring about their recovery. When people don't know this kind of illness, it becomes a problem in knowing how to help them. So Sharon will be throwing some big light on this area. And Sister Sharon, over to you. You are welcome.
Hello, everybody. Glad to be back here again this week.
Great.
And on last week, we talked about mental illness, and we talked about the different types of mental illness and how addiction has an effect on mental illness, and mental illness has an effect on addiction. And so what we're going to do is, for the next couple of weeks, we want to take a specific mental illness and talk about how addiction affects it, and maybe how it affects the addiction. And so this week we're going to cover bipolar. And so we're going to talk about addiction and bipolar disorders, and are they related?
Good.
So I am going to be covering an article by Ben Lesser. This article came out in March 7th of 2021. And I'm going to be using that article to do most of my discussion. So I want to give credit to the creditor, to the person who wrote the article, because I told you, nothing here is my original work except what I share my experience on, the things that I have lived. But I be remiss if I didn't give credit where it was due.
Good.
So one of the things that the author talked about was the fact that bipolar disorder was initially referred to as bipolar depression because it is a grave mental illness that involves extreme emotion and mood swings and affects your energy level. Most of the time, people battling addiction have a mental health issue like bipolar disorder. And here's the thing.
Sharon, before you go deep, I wanted to ask, do you have a little understanding why they call it bipolar depression?
Well, they call it bipolar depression because 1 minute you're up and 1 minute you're down, and you go from different poles. It's like you're going from different poles, different ends of the spectrums. Because 1 minute you're here and 1 minute you're there. You go from high to lows.
I get
And
you.
and that's why then they just named it bipolar,
Bipolar
because
depression.
it, yes, you're going from different aspects.
Wow.
So in his paper, what he discovered was, doing his research, was that approximately 60% of people with bipolar disorder has had abused substances in the past.
Yeah, that's true.
The real reason why most people with bipolar disorder abuse substance is unknown, even though substance abuse also aggravates the symptoms of bipolar disorder. There are people with no history of mental illness, or dormant symptoms of bipolar disorders can grow to exhibit symptoms due to substance abuse. So basically, there are people who have not had any symptoms of bipolar disorder. And so what the paper is saying, that these people can still have symptoms that, because of their substance use, can have symptoms that can mimic and create a bipolar disorder, because bipolar is a chemical imbalance in the brain. So that's what it is. Now, I myself suffer from bipolar disorder. And so it's extreme highs and extreme lows. And that's what happens. And I think on last week I was sharing with you individuals here that when the lows come, it's like a state of depression. And one of the things that I had to learn was, when I'm depressed, I don't always look like what we have come to recognize depression as. Because I myself, when I was first diagnosed, thought depression was just laying in the bed, um, or just with the covers over my head in a dark room or whatever. That's not always depression. Depression, sometimes you may see an individual that's going to work, or individual that's outside in the sun going and doing places, because depression doesn't necessarily have to mean that I'm in a dark room. I can be in a light atmosphere, but I can still depression. Some of the symptoms of depression are that the lows in the low end of the bipolar gamut, sadness. There can be sadness, fearfulness, and there's feelings of despair. Depression can last for days. It can last for weeks. It all depends on the mood cycles. And I know there was a period of time in my own life where sometimes there could be rapid cycle. They call it rapid cycling, where you go to the next, and because usually your cycles come with bipolar disorder. My experience is, your cycles come. You may have periods of depression that could
Wow.
last for 3, 4, 5 days,
So
and then
Sharon,
the
if
next.
you don't mind me interrupting you, what do you think in general, just for the purpose of our viewers, what do you think actually there are triggers for depression? What do you think? Just to help somebody listening to us this evening.
Well, I couldn't tell anybody necessarily what the triggers for their depression are, because I'm not sure sometimes what my own triggers are. Because once again, I said bipolar disorder is a chemical imbalance in the brain. And for me to tell you what the trigger is, I would have to tell you what causes the imbalance.
Yeah, you get it.
I would have to be able to tell you what causes the imbalance. And
Wow.
I don't always know what causes the imbalance.
Yeah, I get you.
But I can tell you that once that occurs, and it may be diet, it could be lack of exercise, it could be environmental. I'm not sure. I'm not aware of what causes that.
Yeah,
But
yeah,
it
yeah.
it my life can be happy. I mean, I could just win the lottery. All the kids are doing
Feeling
great.
extremely
Somebody
happy.
did, so it could be a lot of things going on. No, what I'm saying is, outwardly there could be all signs of success, and people would equate that with, this person should be happy. What do they have to be sad about?
Yeah, I
Why
get
should
it.
they be what are they fearful? Why are they have this despair? But so depression can last for days. It can even last for weeks. And like I said, it depends on where your individual is with the cycle.
Mm.
Now, one of the things about bipolar disorder, when people are treated for bipolar, I know in my own experience, what happens, and I can tell you this is one thing I understand, is that when we start feeling better, we stop taking our medication. So that can be a trigger for the depression.
Is it
That can be a cause.
is it medication for depression you are talking about?
No, it's medication for bipolar because you keep saying depression, but I'm telling, because you have people that are depressed that that is not bipolar.
I get you.
So
I
we're
get you.
talking about two different conditions.
Mm.
We're
That
talking about two different conditions, and it's important that we separate them because a person that is suffering from mere depression
yes.
may not have the same kind of depression as the person from bipolar disorder,
Yeah, that is
because
why
that person's
that is why they call bipolar disorder manic depression. It is called manic depression by some other authors, just to get a difference. The difference between depression and bipolar disorder. So not everybody that has depression has a bipolar, but a bipolar is a high level. They call it the manic depression level. So that is what is said by some people that are more or less writers or those that have done a study on this that deal with all these severe mood swings. So go ahead.
yeah. So as I was saying, um, it's the periods of when you're dealing with. I kind of lost my train of thought there, but
Sorry.
no, that's all right. There's a high end and a low end. So we were talking about, we want to cover the low end. So at the low end, and like I was, oh, this is what I was saying. So most of the time, the balance where we're neither manic or we're neither depressed is because for a lot of us, there's medication. So the
Mm,
medication is what helps to maintain the balance. It
mm,
helps to maintain the balance.
mm,
So one trigger to falling into the level of depression is because either I built a tolerance for my medication or I stopped taking my medication once I feel better. So I
mm,
did have so that is an answer for that question that you asked earlier
mm,
about what are the signs or what makes a person go into depression.
mm,
So that is one of the reasons for myself,
mm,
because I either stopped taking the medication or my body has built up a tolerance for the particular medication I'm taking.
mm,
So yeah. So when that happens, I have to either go back and see my doctor, and he raises the dosage of my medication, or we change and I take something different.
mm,
So, but some of the signs of the depression from bipolar are hopeless feelings, loss of interest in things that used to make me happy, fatigue, changes in my appetite, self loathing, and suicidal thoughts. Now, those are the same kind of thoughts that people regular depression have. So I
mm,
wanted to emphasize that the depressions may look similar. This person that's just suffering from depression and a sense of sadness may look the same. But the thing with bipolar disorder is we get into what is called a mania.
mm,
And the mania, is that the high end of a mood gamut. And when we get that, it's moments of great significant pessimism or optimism, grandiose feelings, rapid talking, little sleep, impaired judgment, irrational behavior, delusional behavior, and hallucinations. Now, now, if I had to say which one of these was the worst, or which one of these were most dangerous, I would think that the mania was. And now when we talk about this disorder and the mania, and then we looked at, I want to cover this, when we look at that in addiction, here's some challenges that are faced. Addiction professionals face challenges in treating individuals with bipolar who also have addiction issues. For one thing, most of the symptoms of the disorders are similar to those of to drug abuse. Therefore, when a person does seek professional help, it's difficult to see where the mental disorder stops and the addiction begins. And my particular drug of choice was a stimulant. So, when dealing with a stimulant, it mimics a manic episode. Because if I am going through a mania and I'm also putting on top of that a stimulant, which one is occurring? Is it the addiction that's occurring, or is it the bipolar that's the manic part of my bipolar that's occurring? So it makes it difficult for them to be able to tell which one. And that's why it's important when treating an individual with an addiction issue, if they also have a mental health issue, that you have to be able to treat both. And what happens oftentimes, we have people with addictions who go, they get treatment for their addiction, but they don't address the mental health issues. And then you have people that have mental health issues that don't address the addiction. And then that's why the cycle continues. There's a continuous cycle. That cycle just continues and continues because, okay, so say I get help for my mental health issues. I'm bipolar. I go, I get medications. Now I'm even keel. But I don't address the fact that I'm using drugs, right? So now the drugs will trigger the mental health issues. It doesn't matter that I'm taking the medication, the drugs are going to trigger my mental health
So
because either I'm going to
some
use,
people, not to, so some people, while they are on medication, they go and take drugs. Is that?
yeah,
Wow.
some people still take drugs. Some people maybe because they were used to self-medicating and the particular drug they on may not be working because remember I said to you earlier that there are periods of time where my body gets used to the drugs, I build a tolerance, it stops working. So maybe in between that time, I can't see my doctor, so then I self medicate.
So it gets to some point while people are going through their medication that their body develop tolerance. So does it mean
Yes.
when people's body develop tolerance, the medication stop working?
Yes. Once your
Wow.
body develops a tolerance, and that's with any type of medication, that's even if you have a physical problem. If you have pain and you're taking a drug, pain medicine for the pain, if you've been taking the pain medication for 500 milligrams, say you're taking 500 milligrams of any kind of pain medicine, and you've been on that for 3, 4 months, eventually your body builds up a tolerance where that 500 milligram is not going to be enough to get rid of the pain. So you're going to need a higher doses. That's another thing, and that's another topic for another day. But that's how a lot of people become addicted to drugs
And now
because the doctor,
not only now even addicted to drugs, they now become addicted to the medication they are given now.
right? Well, that's what I'm talking about. The medication is a drug. See what a lot of individuals don't understand. A lot of parents, spouses, employers, what they don't understand, even judges and police officers, and they don't understand that a lot of addictions start real innocently. They start real innocently. They start as a result of somebody either being injured on the job or having a traumatic experience. The individual gets prescribed some medication, especially when it comes to pain. There's psychiatric medication also, but the individual gets prescribed some medication. The individual does not have somebody to help them monitor that medication, or because most of us says, "Oh, I'm an adult, I can handle this." They build up a tolerance. The doctor, especially when it comes to pain medicine, you have some doctors that would just keep giving them a script, to keep giving them a script, keep giving them a prescription, right? Now they build up this tolerance, and then all of a sudden the insurance stops paying for it, or the doctor says no more. Now, now you have to pay out of your own pocket for this pain medicine. But one prescription could probably cost you $800 for
Wow.
your pain medicine. Who can afford $800? So you go tell your buddy, man, I'm in so much pain. My prescription is $800. The insurance company won't pay for it anymore. He says, "Oh, I got a friend of mine. I can get you a few pills." Now you're on the street buying your medication. And then after you buy it on the street for a couple of times, somebody tells you this. Somebody says, "Well, you know what? I got something that will help your pain and is cheaper than this medication." Then they give you then they give you heroin.
Wow.
So that's how a lot of people end up getting, and I know we're going off topic, but that's how a lot of people innocently get addicted to a substance. You know, even Ritalin. Ritalin is a stimulant. Ritalin they give for ADHD. I know friends who have been addicted to Ritalin.
What is Ritalin?
Ritalin is a stimulant that they mostly prescribe to children, but some adults with ADHD get it as well.
What does that treat?
It's adult it treats adult ADHD, adult hyper effectiveness. I can't think of it right now. I don't
I
want to
get
make
you.
anything up.
I get you.
Right. But it's another mental illness, a disorder. It's another disorder. Right. Now, even for sleep, now my doctor prescribed to me Ambient for sleep. Because I'm in recovery, I knew I couldn't take the Ambient. But Ambient is highly addictive. Had I continued to take it, I could have developed an addiction to that medication. Not only that, I would have blown my clean time, and I'm not trying to do that. I protect my clean date. But Ambien is highly addictive. So now, after 22 years of recovery, here I am. I would have been addicted to a sleeping pill. And it's not the sleeping pill, it's the effect of the sleeping pill that I would chase. Because then we start chasing the feeling. Because addiction is most often addiction is about a feeling. There's a feeling that you get from whatever that substance is. And because you want that feeling, you start chasing that feeling.
Wow.
Right.
Wow.
So, yeah. So when we talk about the challenges, many people do not receive the care they need and are asked to leave recovery programs because they don't have conventional treatment methods. And that's why if you have an individual that is going into treatment, you have a loved one, and that you know they have a mental health disorder, it is important that you send them into a treatment facility that will treat both of their conditions.
That is when you
That
say
will
both conditions. What are the two conditions you are referring to?
I'm talking about treat their mental health condition and treat their addiction.
Okay. 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 Okay.
Okay, because you'll hear the term dual diagnosis
Yeah. Dual diagnosis. Yeah.
or comorbidity.
Yeah. Comorbidity. Yeah.
Yes, so it's important that you get them treated. The dual diagnosis recovery facilities understand the overlapping nature of bipolar and substance abuse. When you have dedicated treatment facilities specifically designed for a person that is bipolar, they can provide appropriate treatment at a reasonable cost and also treat the person's addiction, not just their mental health disorder, which we're talking about this week would be the bipolar. So So that's the link. The link. When we talk about the link, that's the link.
Mm.
There are some different things. There are therapeutic methods that are used. I think you're familiar with these: cognitive behavioral therapy
Yep.
and
Is yes. Yeah.
dialectic behavioral therapy (DBT)
Yes.
have been shown to be successful in educating dual diagnosis individuals on how to regulate their feelings and avoid being distressed by mood swings.
Yep.
That's that's one course of action they have taken for bipolar disorder. That's I've been in a DBT. I've taken DBT courses,
Mm.
and it helps you to regulate. And that's that word again. We go right back to that word that I used earlier: feelings. It
Mm.
teaches us how to regulate our feelings
Mm.
and avoid being distressed by mood swings.
Mm.
Here it says if you have a concurrent diagnosis of a bipolar disorder and substance abuse disorder, group therapy is vital to your recovery. During
Mm.
during peer group support groups and counseling sessions, you'll learn about the common cause and consequences that people that are bipolar face. You'll have the ability to share your thoughts and learn strategies that help from others. Psychotherapeutic medication is widely used, and this is what we were talking about earlier. Psychotherapeutic medication is widely used to treat bipolar disorder. Mood stabilizing drugs may be taken together with antipsychotic or antidepressants to give a full range of treatment options.
Mm.
And that's why I take one pill for the depression, so I won't go too low, and then I got another medication I take so I don't get too high, and they balance me out.
Mm.
And so if I'm not taking my medication, and that's what the doctors, their goal is to keep me at an even keel, so I'm
Mm.
not so high or I'm not so low.
Mm.
And so it's, and here's the thing: in the community of people of color,
Mm.
and I say people of color, there's such a stigma attached to mental illness that the rate of substance abuse is greater because we self-medicate. We want to
Mm.
self-medicate, and that's how the rate of addiction is so high,
Mm.
because we have mental illness. We're suffering from mental illness. We're dealing with mental illness, but we won't deal with it appropriately.
Mm.
Instead of going to see a mental health professional, we deal with it on our own by self-medicating. Now,
Mm.
most of us won't even be aware of the fact that we have this mental illness. We just know something is wrong. Remember last week I said we hear the voice,
Yep.
or we know that we just high, the manic part. Because
Mm.
when we talk about, there's another thing, and I have a paper here. I wanted to read this right here. It
Mm.
talks about hypomania. Hypomania symptoms are similar to those found in mania, but they are less intense.
Mm.
There's another hypomania. Individuals with hypomania are usually capable of managing their everyday lives,
Mm.
but they experience a higher than average level of happiness, irritability, or energy. They
Mm.
may feel like they can handle more responsibility or they need to sleep less. You're more talkative or friendly. They may also be prone to engage in risk taking behaviors
Mm.
such as substance abuse. For certain people, hypomanic cycles are incredibly productive, and since psychotic symptoms do not occur during hypomania, it can appear that you don't have a problem.
Mm.
Then there's the thing they say: mixed emotions. The
Mm.
symptoms that come with bipolar disorders aren't always clearly defined. In a
Mm.
mixed emotion episode, symptoms are usually a combination of mania and depression.
Mm.
Can you imagine feeling, for instance, they may have suicidal thoughts and lose interest in their daily routines, coupled with racing thoughts, pressured speech, and loss of sleep.
Mm.
So you're going through your depression and your mania at the same time. That's
Mm.
what remember earlier I said rapid cycling?
Yep.
because you're depressed but manic at the same time.
Mm.
That's a horrible feeling. That is a horrible feeling. So, an individual experiencing that without proper diagnosis and not having someone to share that information with, then they need something. So, they go out and they find something on the street to help them not have to cope with what they're feeling.
Mm.
And so once we take the stigma away from mental illness in communities of color,
Mm.
it makes it easier for people to start talking about. And I commend the athletes of color that are speaking up. I
Mm.
commend them. I commend the
On
fact
mental
that they're
health.
now on mental health, because what it does is it's opening up the door for other people to, like, regular people like us, to be able to talk about it.
Mm.
And maybe if we start treating the mental health issues, the rate of substance abuse may not be as high.
And
you
people
know
will not be looked at with stigma.
Right. And that's the reason a lot of people don't get help for their substance abuse issues, and they don't get help for their mental health issues because of the stigma that we attach to it. Now, would we
Mm.
rather know that a person, we have to ask ourselves this question: would we rather know that our loved one is dealing with a mental health issue and get the necessary help they need? Would
Mm.
we rather know that our loved one is dealing with a substance abuse issue and help them get the necessary help that they need? Or
Mm.
would we rather just stigmatize them so that they can stay out there and die, or stigmatize them to a point that they don't feel like they can tell us and then they kill themselves?
Mm.
You have a lot of suicide because nobody chooses to be an addict. People don't
Mm.
choose that. That's not a conscious choice that some 12-year-old, some little kid, you ask them, you go to school, and then, they show up at school and the teacher says, well, little Johnny, what do you want to be? And he says, I want to be a dope fiend.
Mm.
I don't think show and tell and career day, little Johnny ever says, I want to be a dope fiend.
So what
Or,
does
or
that mean?
little
What's the meaning of dolphin? I mean, talk to because of our viewers. What does that mean?
so when we talk about being a dope fiend, we're talking about somebody that's using intravenous drugs, or a dope fiend could be somebody that's using, like, opiates, or sometimes that word can be synonymous with any type of drug use. you
Wow.
know yeah, nobody said that. Or little Chrissy. Chrissy didn't say, I want to walk the whole stroll. She don't
Mm.
say, I want to walk the whole stroll all night long so I can buy drugs. Nobody
Oh.
says that. You think she want to sell her body all night to buy drugs? No, no kid. That is not
Mm.
what people choose. I mean,
Mm.
it would appear like they choose it because people will say, well, if they want to stop, just stop. It's not that easy. It's
Mm.
an addiction. It's a
Mm.
disease. That's why
Mm.
they say mental health. That's why addiction is classified a mental health.
Mm.
And we have to stop stigmatizing our loved ones, our friends, our family members, and start
Mm.
supporting them. And I'm
Mm.
not saying I'm not advocating that we uphold people in their bad behavior.
I get you.
Understand, what I'm saying is, have some compassion
Yeah, I
and
get you.
understand you can't just say, oh, if they got self-will. It has nothing to do with self-will.
Mm.
Before I got 22 years clean, I struggled for 16 years.
Mm.
I used when I didn't want to use. There were days
Mm.
I woke up and said, I am not using anything today. I am tired of this. I don't want to live like this.
Mm.
And by 12 o'clock, I was high as a kite in the sky and trying to find ways and means. I didn't even realize at the time that I was suffering from a mental illness.
Mm. Mm. That is, you did not even
And
know
so
at all.
I didn't know because nobody had ever said to me, And I thought, who, me? Not me. It's not possible that I can have a mental illness. I grew up in a community of color. No, we didn't talk about mental illness. Nobody talked about mental illness in my family.
So that
And the
that
only
that, that
mental
also
illness,
means, Sharon, that also means that there are many people that are having this thing and don't know they have it.
that's exactly. The only thing I knew about mental illness growing up was, I think the only mental illness that I was aware of was schizophrenia. And I think the reason I was aware of that because my high school was close to this place called St. Elizabeth. A lot of people may have heard of St. Elizabeth. And
Which,
because the
which
guy that
state?
tried,
Which state is that? Is it Maryland or
it's in
Virginia?
Washington, D.C. It's in
Okay.
Washington, D.C. And I say that because I believe the guy that tried to kill the president, one of our presidents, they sent him over there. And that's why people may have heard of it. But anyway, my high school was not too far from there. And it's a lot, it's for mental, it's like a mental village for people. And I remember we would see those people and they would be talking to themselves. They would walk around and talk to themselves uh, and so that was the only idea. And I never was doing that kind of stuff. So I would never think I had a mental illness. And I think it would be great if they talked about mental illness in school. Maybe they
Don't
should
you
add
think
that.
that I think that is what we are talking about, Sharon, to add that to the curriculum of the school
Yes.
so that people
Yes.
can get to know this at early stages and
At-
identify mental health issues at early stages. In fact, if the children know what these things are, people can even live to avoid those kind of lifestyle.
I totally agree with you. I totally agree that if we start educating people on what the signs, what the symptoms may
That
be,
early
they can
signs.
see it, early signs, and then they don't have, what would happen is they wouldn't have to try to self medicate from like some symptoms of things that they don't know what's going on. They don't know who to talk to. So it's easier to drink so you don't have to hear the voice, or it's easier to smoke some weed so you don't feel so hyped up. So,
So,
or it's easier if I do this to counter that.
I wanted to ask Sister Sharon, at the present moment of school curriculum, does the school curriculum ask anything like this at the elementary stages?
To the best of my knowledge, because I've been out of school a long time and I did my last graduate studies about 5 years ago. In regular school, K through 12, I don't believe they're offering any kind of mental health. I do know in graduate school, you can take up mental health training. There's different courses that you can take dealing with mental health. But as far as K through 12, I don't believe they're offering it unless there's a specific health course that maybe an individual takes that may cover it.
Yeah,
But yeah, that's as
I
much as I
think
know.
like I'm thinking that at the early stage of school curriculum, if it's been introduced at primary school at some levels, secondary school, just to create awareness, I think this may help to reduce the stigma on it.
Yes. Yes, that's something I believe that's something that could be worked on, that there could be a curriculum created. A curriculum could be created just introducing something that could be that could start maybe say third grade and then it could be built on. It
Well,
could
that
be
is
something
why,
as a simple.
yeah, that is the reason when I wrote that book on making right choices. I wrote that book because of children. I wrote that book because of students. Because I know that many people don't actually spend any time to bring awareness on the effect of this substance and the brain development. That's what I wrote on that book. And that's what I wanted to do, to see how we can get those books to schools when they allow it, just to create awareness.
Well, that may be an idea that we can probably try to see if we can get that book and send them into the schools. if they would allow the schools to take the book and put them in their book as part of the curriculum or part of their reading, add it to the reading list.
Yeah, because
That's
yeah, that's one
something to
of the
consider.
reason. Yeah, that was one of the reason why I was asked to speak to those students that I spoke to in Las Vegas, just to bring a little awareness, so that they are aware of the effect of this substance on their brain. And is
Okay.
what we're going to be working on under this recovery community services, on how to develop curriculum that can be passed across to school to help create awareness of all these things, so that when the children grow up, they can make right choices in their journey of life.
Yeah.
So
Okay.
that's what we want to do. And we want to do this in the US, we want to do this in the UK, because I believe that if this can start in my university, when I was in the university, it's part of my project. We call it early intervention, to be able to help
Yes.
children, even parents, to understand the early stage of these things, because many parents are ignorant. They don't even know what this thing looks like. So I believe quite right that getting parents and students and school get involved, this may help to reduce treating this problem at an adult stage. Like somebody said, it's easier to build a strong child than to repair a broken adult.
Amen. I agree.
So
I agree.
this subject is so interesting. Is I believe quite right that we are going to deal more with this, and as we've been talking about this aspect of this of this bipolar disorder, because I discovered that the bipolar disorder itself is just one of the personality disorder that many people have, and some may come as hereditary, but those things we have mentioned, the psychiatric drugs, the psychodynamic therapy, I mean, you are talking about cognitive behavior therapy, we are talking about dialectical behavior therapy. Those are things that can help that DBT. And you also have what is called skill learning group work, and also therapeutic community treatment. All these things have been laid out on things that can help many people that are going through this. We decide to say this so that we don't just talk about a problem and no mention possible solution way out.
That's right.
So the therapeutic community are also key to interventions where a client are actively involved in day-to-day operation running of the whole community and encouraged to collective supportive of each other's need. Like you mentioned, anyone that is having these things, they will do well if they get involved in group, like people talking about going for
Therapy.
12 steps, therapy,
Right.
going to peer support groups where people can talk openly about it. People can talk about, I'm having this.
Right.
I've been in a group where we are in a team where we are everybody discussing about area where they are facing stuff, and some people have come up with wounds on their leg where they are using the needles and the effect of the needle on their leg. That is DPN. We call it DP. That is where they inject their vein. That is on their legs, and start bringing out pus. It was in the group, and people they say no.
Access.
Yeah, abscess, having abscess on the leg, and some of them would guys say,
Yes.
look, it's get if you go on like this, they'll cut off that leg. I'm ready to follow you right now to the hospital. It was in a group discussion, so the guy was
Hmm.
able to come up and literally explain himself, and he was helped in that meeting.
Yes. That's the same thing we get. I attend 12-step program, a 12-step program on a regular basis. I try to get me a meeting in daily, if not daily, at least 3 or 4 a week. And at the VA hospital that I frequent, I try to get groups in there as well, because I suffer not only from bipolar, but I also have been diagnosed with PTSD, and that's
Really,
one of the topics we'll cover later as a result of a traumatic experience I had while I was in the military.
Oh,
So,
great.
so the groups do help when you're talking to your peers and you are able to express what you have feel, what you're feeling. I'm sorry, what you're feeling. You're able to express what you're thinking, because oftentimes your brain is my brain can be my own worst enemy, because it
Mm,
will tell me that nobody want to hear that, or nobody thinks like you think. Like, wow, you're really crazy. Like,
mm,
who would think something like that? And when I get to expose, because it's very important for me to expose my thoughts, because if I don't
mm,
expose my thoughts, I can act on my thoughts, especially when I have negative thoughts. So when I
mm,
expose them, somebody else helps me to see how irrational they are.
mm,
Like, the world hates me. The world, how, why, why does the world hate you, Sharon? The world don't even know you, Sharon.
mm,
The world, so sometimes, I know that's just a trick of the enemy, though. I know
mm,
the enemy's desire is for me to not succeed. And so the
mm,
enemy speaks to me in my own voice,
mm,
and will cause me to do self-harm.
mm,
And so the fact that I have been in groups, the fact that I have peers who have helped me. We say a thing in my 12-step program. We say you're as sick as your secrets.
mm,
And so that's why I don't hold on to secrets.
mm,
And that's not to say that you tell everything you know. It's just that you just don't hold on to secrets, because secrets keep you sick.
mm.
Yeah. So I just want to read one last thing before we end here.
Yep.
Um, so it says people with mental health issues may use substances to feel better. You may use substance because it helps you feel more comfortable and accepted.
Mm,
It may make you feel like you don't have a mental health issues.
mm,
But some people is I don't and to self-medicate. We already described that. You may use
mm,
substance to reduce the anxiety or depression, sleep problems, tension, hallucinations, and the side effects of medicines.
mm,
People like, especially the medication that affects, cause you nausea and all that. I've known some people that use marijuana to help with that.
mm,
However, while using substances may make you feel better for a short while, regular or heavy use can actually make your mental health issues worse over time. You can get caught in a cycle of drug, um, substance abuse. You use these substances to feel better, but they actually do harm. They
mm,
harm your health and relationships and make your symptoms worse.
mm,
To feel better, you use more substance, and this continues the cycle. And
mm.
so I think you remember when I was saying that you were taking 500 milligrams, now you got to take 1,000 milligrams, and that goes up to 15, because now you want to feel better. You got to keep taking more.
But they get
It
to
is
some
important.
point where the heart can no longer take it.
Yeah, but I was amazed to find out. I had somebody tell me that they would take 20 Percocets and 20 Valiums. That's a lot of pills. I was like, how can you? But because it builds up a tolerance.
Mm,
So here it says programs such as Alcohol Anonymous, Narcotics Anonymous, are often part of medical care and recovery. You most likely would attend
mm,
individual and group therapy is also good, exercises, and healthy eating. And this is one of the ones I wanted to read, because we went over this. It is important to find ways to cope with your mental health symptoms other than using substance. Ask
mm,
family and friends for help, get advice, meditating, or something that may help. The reason I wanted to read that part right there, finding ways to cope, because when we talked about coping skills, we
mm.
talked about, it says ask family and friends. We talked about that. We talked about getting advice. We talked about
Yeah,
meditating.
yeah.
And so if you pay attention, you will find out that a lot of these things that we discuss, you're going to hear them again and again in different parts of the program that we talk about. So it came right back to us talking about coping. You're going to need good coping skills to deal with your mental health issues, to deal with your substance abuse issues. Good coping skills. Even when I'm manic, because I don't just have to address my my substance abuse. I have to address my mental health too. Because if I'm not addressing my mental health and I'm not using good coping skills, that can send me back out to using a substance again. It can cause me to say, you know what, I don't want to feel like this. Let me go drink something, smoke something, take a pill so I can feel better when I'm feeling depressed for 2, 3 weeks. So if I don't learn how to use coping skills, for me sometimes it's just as simple as positive self-talk. Like when I've been in the bed for 3 or 4 days and then I say, this is crazy. You get yourself up right now. Or I call up or I have accountability buddy who calls me and say, I'm on my way over there. You getting up, we getting ready to go somewhere. Put some clothes on, take a shower.
Yeah.
Those are coping skills. Those are having friends that help me, that people that know. But if nobody knew I had mental health issues, I couldn't get the help. So it's important that people know me and know about me and know what's happening in my life. So if I chose to hide the fact that I have a mental health issues, nobody could help me. And I could stay in my house and suffer by myself. So with that being said, thank you all for viewing us today, joining
Yeah.
us today,
Today
and
was
I'll see
good.
you again next week.
Good.
I'm gonna. All right. So bye bye.
Well, this was a good one that we did today with Sharon. What a wonderful time. This was very understandable discussion. We're getting those books ready, and that will help. One of my books that will help many people that are listening to be able to have early stage of identifying these things. That was the book I wrote on making righteous. So Sharon, thank you very much for sharing your experience with us. And I believe this will help to point light in the direction that will help other people. Thank you very, very much. And I believe we will you coming your way, everybody, next week uh, uh, on other area that I believe will be of help. Next week is the first week of September, so uh, we'll be starting our program for the new month. But we'll be coming your way the second week in September, and I believe that somebody is going to be blessed by all these things. Please share this broadcast with others and let them know quite right about this. Share it, and I believe quite right this will be a lot of blessing for so many people. Check it on our website, on our YouTube. Recovery TV is here every Wednesday, except for the first Wednesday of the month, where we shine light in all this area of things that can help you to be better and get help you needed, the therapeutic help you need to be able to help you to be a better version of yourself. And I believe you can get what is called structured and systematic psychological treatment that can help reduce self-harm while improving your social and interpersonal functioning for patients with borderline PD, that is personality disorder. God bless you. I look forward to seeing every one of you. Tomorrow, we are here 8 p.m. for another prayer for your business and your career. Don't miss that at all. Don't miss it, and I promise you'll be blessed. And these are the books I'm talking about. If you are not gotten this, get this clear. This is the book I'm talking about, Making Right Choices. This book will help you. Get this book on my website. making right choices. Life is a matter of choice. And I believe this will help you to be able to be a better person if you get this book to show you the connection between your mental development and substance misuse. And this, I believe, will help many people to make right decisions. Get this book on my website, and I believe it will be a blessing to you. Until I come your way again, I look forward to seeing us tomorrow by 8 p.m., which is 3 p.m. Washington, D.C. time. And also, I believe quite right that Friday will be here and Sunday will be our Super Sunday. Don't miss out of all this program. God bless you as we come your way again this tomorrow. I share this broadcast with others on YouTube. Share it on our recovery mandate, this recovery TV YouTube, and our also on the on Facebook. Share with other people, and I believe they're going to be blessed. That will help to strengthen people and can point light where it belongs. God bless you. Look forward to see you again. Bye bye for now. Bye bye everybody. Bye.